Good evening, all. You are all welcome to this session of our lecture where we will discuss on the high yield topics on Mdcn assessment exams. And the aim of this presentation is to guide you to know what is ahead of you. Knowing what is ahead will actually get you well prepared for the exams. Another aim for this presentation is also to guide you on seeing the true picture of what the exams is all about and why a lot of people fail the multiple choice questions. Because if you know the actual extent you have to go or the actual extent the exam covers, it will guide you on knowing how to prepare. Yes, because of course, the best preparation for tomorrow is doing your best today. And of course, if you sit up all what you've heard about these exams, you realize they are all hearsay. If you are well prepared for the exams, you will not have any challenge in passing these exams. So you should know a well-prepared average candidate for an exams. Any form of exams should conveniently cover more than 50% of all the required topics. That is for an average candidate to conveniently pass an exams. And for you to cover 50% of the expected topics or your requirements, you must even know what these requirements are. That is to start with. And for an excellent candidate, which is what you all should be targeting, must be able to cover more than 70% of the required topics conveniently. Now, what you need to understand, a lot of complaints were made regarding curriculum for the Mdcn exams, and they have always defended that point by saying the red book is available, the Mdcn red book. And that red book is not only for Mdcn assessment exams, is a book that contains the curriculum for MBBS training in Nigeria and all the guidelines. Now, it is available online. If you just click on the Mdcn Red Book, you see a PDF copy available online. And if you go through that, you will realize within the short time you have, you cannot be able to cover all the topics in there because it's just a book that has all the topics for MBBS curriculum. But however, there are some topics amongst this that are high yield topics. They almost always feature in exams. And why is that so? They almost always feature because they are common conditions in our environment. So every average candidate must be able to cover conveniently about 50% of all the required topics, especially the high yield topics. And of course, we are hoping to achieve excellence, becoming an excellent candidate, not just an average candidate. And the greatest target in your academic professional career or any task you embark on is to achieve excellence. That should be your primary goal. Other things usually come as byproducts of excellence. Now, you should know the goal, as we earlier mentioned during the orientation, that the goal of the Mdcn exams is to ensure the candidate has a good foundation of the basic and clinical sciences for healthy medical practice and medical education. Now, our goal for this presentation is to show you and guide you on what is ahead of you, and you also see the reason why people fail these exams. If you are to objectively ask these candidates how much of these topics they covered, you will find out only less than 50% cover even half of the expected. And also, the subjects which you need to prepare for thoroughly for these exams are medicine, surgery, obstetrics and gynecology, pediatrics, and community medicine. Please, this should be clear because I'm receiving some controversial questions from some candidates on some topics that are not parts of what you are supposed to be preparing for. Take note, these are the topics. Now, along these topics, there are some topics that touch some other aspects of some specialties you think they are asked, but these are the main things you need to know. Now, you need to understand the allocated period for these postings in our own environment. During the course of training, that is your MBBS, the minimum period that is allocated for posting to those specialty by Mdcn, that is during a clinical posting for any medical student in our environment, the minimum duration of medicine posting is 30 weeks, both the junior and senior posting. For surgery is 30 weeks, O&G is 18 weeks, pediatrics 18 weeks, and community medicine 20 weeks, including the 6 weeks that is done in the preclinical period. Now, during this period where you are expected to see patients, make presentations, and also attend lectures, now, based on their own standard, if a candidate trains elsewhere and he do not have a posting that covers all that covers this allocated duration based on their own standard, so it is defective. But of course, the only way they can assess that this candidate is well trained is by providing an exams, okay, based on the curriculum of our own training here. Yes, because of course, the students here must cover minimum of all this duration during their clinical postings. Now, of course, we mentioned this, that the essence for this exam is to ensure all these have been achieved during the period of training to ensure safe and healthy medical practice. Okay? All the list of topics to cover can be found in the Mdcn Red Book. This book is available online. If you type Mdcn Red Book, you'll see them. However, our focus are only on the high yield topics because you have only 4 months to write your exam, 6 months to write your exams, as the case may be, depending on when you start preparing. Now, you cannot read all those topics, but those are what a house officer who just finished his MBBS, okay, is supposed to know as per their standard. You can see why it's very difficult to win argument against the case they present, because they will lay down this topic and ask you, have you gone through? They have justification of certain questions from any of those outlined topics. So you should be conversant with that, their red book. Now, before we go into the high yield topics, you should know any topic you are studying, okay? A typical outline for a topic should include a definition for that condition you are studying, epidemiology, if it's applicable, etiology or risk factor, the risk factors for that condition, types or classification for that condition, clinical presentation, investigations, treatment, complications, and follow-up. So I'm giving you a template to assess whatsoever topic you know, okay? This will guide you in assessing what you know and what you don't know. If you've read a topic, for example, ask yourself, based on this outline, where applicable, can you answer some certain questions regarding that topic? Because if there are certain any questions, any question must fall under any of this heading. Okay, so if you are studying a topic, make sure you go broad and touch these areas that are highlighted for you, because this forms a typical outline for studying any topic. Okay, so now we are going to start with internal medicine. You should know in internal medicine there are various subspecialties. Okay, cardiology, dermatology, endocrinology, gastroenterology, hematology, rheumatology, oncology, respiratory medicine, neurology, nephrology, infectious disease. In some centers, especially in our own centers here, most of the teaching hospitals, most of them have all this specialty, either as a unit or two units combined, two subspecialty combined in a single unit. Now, there are several topics in this subspecialty. You are not expected to know all this, but we are going to highlight the important topics you are supposed to master using the outline I just projected, if it is applicable. Now, starting with cardiology in internal medicine, no candidate should go for an exams without knowing anything about hypertension, okay, heart failure, cardiomyopathy, rheumatic fever, especially these first two. There's no way you are studying cardiology, okay, internal medicine, and you are in a cardiology posting, you don't know anything about hypertension, you don't know anything about heart failure, and you expect to pass an exam. It means you have not prepared well. Now, going back to this outline, you will find out that if you are to study any topics following this outline, there is nothing you will be asked at your level that you won't be able to answer. Okay, so hypertensive heart disease, heart failure are important topics in internal medicine. In cardiology, you need to know cardiomyopathy, rheumatic fever, and all the attending complications, rheumatic heart diseases, and their sequelae. Okay, this you should all be conversant with that. In case of nephrology, urinary tract infection, glomerulonephritis, nephrotic syndrome, acute renal failure, chronic kidney disease, or chronic renal failure. These are important topics that are in nephrology. They should be at your fingertips. Now, I want you to understand that there are some certain things that you will come across during the preparation Okay, there are so many things. If you are following your outline religiously, you come across so many things under this topic that you apply them in all other aspects of the exams, especially investigation, presentation of lab results, so many things you come across. Then when you study all these topics, following the outline that is presented. Now, infectious diseases. Now, in our environment, it is not acceptable when a candidate doesn't know anything about malaria, because malaria is an endemic disease in it is always constant. Okay, it is present in a constant proportion at any given time in an environment. Malaria is an endemic disease. So when you talk about malaria, you have to understand that you should study inside out of malaria. Malaria in adults, malaria in children, malaria in pregnancy, complications of malaria. Okay, you should even go as far as knowing about congenital malaria. Yes. So you should know everything about malaria, the life cycle, the treatment, inside out about malaria, because it's an endemic disease in our environment. Now, if you are asked a question about malaria and you cannot answer and you fail the question, that is justifiable failure, because this is something endemic. There is no way you go and be reading about inflammatory bowel disease inside out in detail, cystic fibrosis, and you don't know life cycle of malaria. You can see you are not focusing on high yield topics. Typhoid fever, and the complications of typhoid, they are very common in our environment, both in the medical aspect and complication presenting with surgical conditions. Okay, HIV and AIDS, tetanus. Now, this tetanus in all the specialties, you must know the various presentations of tetanus in pediatrics, okay, how they present, the various forms of tetanus in adult medicine, even in surgery, okay? So all tetanus is a then sexually transmitted disease. Now, all these topics you see here, they do not only feature in multiple choice questions. They feature in the picture test as well as your OSCE. Why is that so? Because they are common conditions that are found in our environment. Respiratory medicine. Now, tuberculosis, okay? Tuberculosis cut across all the aspects of your exams, multiple choice, OSCE, okay? Picture tests, radiographs of tuberculosis, everything about tuberculosis you must know, okay? They can ask you in your OSCE level of prevention of tuberculosis, okay? So there is no aspect of the exam tuberculosis cannot feature. Bronchial asthma, pneumonia, COPD, these are common respiratory conditions, okay? Neurology, stroke, meningitis, encephalitis, epilepsy. These are common, especially stroke and meningitis. These are common in our environment, so you have to know. You can see all this we are talking about, they are all in internal medicine, okay? Just assuming these high yield topics, there are certain 300 questions on only these topics we are talking about. You see, there is a very big work, okay, ahead of you. So endocrinology, diabetes mellitus is common, as well as disorders of thyroid gland. Gastroenterology, jaundice. You see jaundice in the picture test. You can see it in the OSCE where they will present a question regarding investigations for jaundice. Hepatitis is very common. Peptic ulcer disease, liver cirrhosis. These are common or high-yield topics under gastroenterology. Okay? Then dermatology, parasitic, especially fungal infections of the skin, as well as viral skin infection, filariasis, guinea worm. You can see even in the last exam, guinea worm came out in the picture tests. Eczema, dermatitis, systemic manifestation of skin manifestation of systemic diseases. Okay, so there are a barrage of skin lesions in dermatology, so you cannot study everything. Okay, but these are minimum high-yield topics you are expected to know. Now, hematology in medicine, that is clinical hematology, they almost always, or they always have a sickle cell disease patient in that unit. Okay? You see, I did not mention thalassemia, even though you know there are several hemoglobinopathies, but at any point in time, the clinical hematologists have a sickle cell disease patient in the clinic or in the ward. Sickle cell disease patient, you must know you must know everything. The biochemistry of sickle cell disease, the clinical manifestation, their crises, their ways of management, the surgical complication, everything about sickle cell disease you must know, okay? The genetics of sickle cell disease. Nutritional anemia, yes. You see questions regarding nutritional anemia in your MCQs and picture tests where maybe a blood film might be presented, maybe of iron deficiency anemia, megaloblastic anemia, various types of anemias that are nutritional can be asked. Thromboembolic diseases, thrombotic disease like DVT, you should be familiar with that. Oncology, not commonly asked, but if you should know anything for adult medicine, is leukemias you should read about. Then rheumatology, SLE, is common. Rheumatoid arthritis. Now, SLE, rheumatoid arthritis, you see them often in picture tests. Okay, osteoarthritis. So these first two are commoner. Now, other aspects that you need to know is history taking, signs and symptoms of diseases, common bedside procedures during your posting in internal medicine that are expected are, you should know about passage of NG tube, passage of urethral catheter, insertion of IV cannula, okay? Now, there are in some instances, during the OSCE, you should know a station might be reserved for describing a procedure. A station might be reserved for having an instrument, okay, you are expected to identify, to mention the size, mention the indication for using that device or material. Or it might even ask you the way the trend is going now, the way the exam is changing, they might ask you to describe the procedure, even though that is always a common question of using all that. During our lectures, we'll talk in detail most of all these things. Now, let us move to surgery. Now, you should know that in surgery, the structure of surgery posting here is there's a junior surgery posting where you have lectures on principles of surgery. Then the bulk of your posting is general surgery posting. General surgery posting, you do it both in the junior and the senior, as well as your revision postings. Then senior postings, there are some specific rotations you go, like orthopedic posting, pediatric surgery posting, plastic surgery posting, cardiothoracic neurosurgery. But this actually depends on the center you train, okay? There are various centers have ways of modifying rotation, but they must cover that 30 weeks of junior and senior, including the revision posting. Then basic skills, bedside procedures, as we mentioned earlier, as well as identifying common instruments that are used in the theater as well as in the ward. Now, the high yield topics of the junior posting or high yield topics are in the principles of surgery are fluid and electrolyte therapy, preoperative preparation of a patient, shock, wound healing, blood transfusion. Now, I have to comment here because at the beginning of this presentation, I told you that there are some topics that may have some components of other topics or specialty, and candidates will think they are asking them questions, a lot of questions from settings. For example, preoperative preparation of a patient, you must talk about anesthesia. Okay, you must talk about anesthesia review. Now, candidates that just saw one or two questions regarding anesthesia, which if you have read the topics on preoperative preparation of patient, you encounter those things. They will now get confused that they ask them questions from anesthesia. Then you now see candidates leaving what they are supposed to read and they are reading anesthesia. Now, let me draw your attention to something. Even if they will ask some questions from anesthesia, ophthalmology, or some short postings, they are less than 5%. You cannot leave 95% for 5%, for God's sake. And secondly, if you read all these topics properly, you will cover those areas you are expected to know in those specialty. Okay, so these are the basic principles of surgery every candidate is expected to know, because it is on these principles you build foundation of your practice as well as even understanding other topics. Okay, now general surgery topics will include breast diseases. These breast diseases, we are talking about both benign conditions and malignant ones. Okay? So the benign breast diseases, as well as the malignant breast diseases, the various types of breast cancer. And you can see in the last exam, counseling of breast cancer came out. Okay? One of the OSCE station was on breast cancer. It's a high yield topic. Why is that so? This is the commonest malignancy that affects women worldwide in our environment and elsewhere. So you can imagine, if this is the commonest malignancy, the commonest surgical disease that affects women, why won't you know everything about this disease? You can't be reading something uncommon for this. Okay, so this can feature everywhere in your exams. As you can see, those that wrote the last exams, this was part of the exams, was an OSCE station carrying 10 marks. Okay, and of course you see them in the picture test. You see a woman with breast lesion. You see this condition in your MCQs. So this is a fairly common condition. Now, acute abdomen. Now, let me tell you something about emergencies. There is no way, you see, when you become a house officer, it means you are the first on call. You will be on call either at the accident and emergency or in the ward. You are the first on call when a patient presents with an emergency. Before you call your senior, it is expected you institute the initial treatment. So there's no way you go for a professional exams like this without knowing the basic measures you need to take when a patient presents as an emergency. Okay? What are the basic principles of resuscitating a patient? So anytime you do a lecture on an emergency, you will be told these are the basic principles of resuscitating a patient. Okay, so acute abdomen in surgery, in general surgery, is very important. Intestinal obstruction. Don't forget the outline I gave. You have to apply that on all these topics. Goiters, that is a large thyroid glands. There are classifications, the modes of presentations, the treatment options, in fact, the investigative modality. Now, these goiters, they feature in all aspects of your exams. You might see up to 3 questions. 3 questions in the picture tests. Now, if out of 50, you have 3 questions and each is 1 mark. Of course, you know the picture test has more marks than the MCQ. If you have 3 questions on goiter, so you see 3 marks. That is 1. Now, it comes out in the MCQs also. In the OSCE, examination of a goiter is a station on its own. Interpretation of lab result of thyroid function test is a station on its own. So you see, this is a high yield topic. Obstructive jaundice is also a high yield topic. It comes out in the picture test. It comes out in the OSCE. How does it come out in the OSCE? Of course, I've attended 2 exams where this came out. 1, interpretation of lab result for this came out, as well as 2 stations on goiter, 1 on the interpretation of the result, and the other is for examination of the anterior neck swelling. So these are high yield topics. Then acute appendicitis. Acute appendicitis is the commonest surgical emergency, because sometimes if you talk about general surgery, what comes to people's mind is acute appendicitis. So how won't you know this topic? Disease of colon, rectum, and anal canal. Now, these are both benign and malignant diseases. We've already given a lot of lectures on these conditions, so you can go and refer to them to revise them. Okay, colon, rectum, and anal canal. We've given a detailed lecture on the benign and their malignant condition. So then in urology, now diagnosis of urologic diseases. The diagnosis, now you need to know when making a diagnosis, they are clinical, okay, and laboratory. Where you have both hematological, radiological. Now, this clinical, you should know signs and symptoms of urological diseases, especially when you talk about LUTs. Now, no any candidate should go for that. If, in fact, any house officer that doesn't understand the LUTs, lower urinary tract symptoms that are both irritative and obstructive. Irritative and obstructive lower urinary tract symptoms. They are part of the things you need to know to make a diagnosis. Is this BPH? Is it urethral stricture? Is it prostate cancer? Because The irritative and obstructive symptom have some certain patterns depending on the condition. Okay, let me give you an example. When a patient, among the obstructive symptoms, the obstructive symptoms include hesitancy, okay, straining, poor stream, feeling of incomplete bladder emptying, and terminal dribbling. These are obstructive symptoms. If you talk about irritative symptoms, they include, okay, frequency, urgency, nocturia, urge incontinence. Now, all these symptoms are seen in LUT. They are seen in urologic condition. But if a patient, for example, presents with hesitancy, difficulty in initiating micturition, you start thinking of BPH, okay? If he has poor stream, it's an obstructive symptom. It's an obstructive symptom. And this increases with straining, okay? Poor stream that improves on straining. You are talking about stricture. It does not improve on straining. You are talking about BPH. So you need to know the irritative and obstructive symptoms. Then you now know what is the likely diagnosis just from the clinical evaluation. Then laboratory, there are various tests you need to know about urologic diseases that will guide you on a specific diagnosis. So here, by saying diagnosis of urologic disease, it means you have to understand all the signs and symptoms. The lower urinary tract symptoms, irritative and obstructive urinary symptoms, as well as systemic manifestations of obstructive uropathy, okay, including symptoms of uremia. Now, there are a lot of congenital genitourinary disorders you'll be seeing on picture tests. They will ask, especially hypospadias. You have hypospadias, epispadias, bladder extrophy, but hypospadias is the commonest one you see in the exams. Okay, urinary schistosomiasis. This is something very common in our environment. And one feature that you often see among patients with this is terminal hematuria. And they have history of bathing in pond and streams, stagnant water. Why is this important? Because it's a precursor for carcinoma of the bladder. So this is very important condition in our environment. Okay, it's an important cause of squamous cell carcinoma of the bladder. So urinary schistosomiasis is a high-yield topic. Then obstructive uropathy. So these are common. There are several urologic diseases, but these are high-yield topics. Then in orthopedics, of course, the basic principles of fracture management, osteomyelitis, multiple injured patients, okay, congenital musculoskeletal disorders. You see them in picture tests. Now, let me highlight this. I've clicked this 3 times. I'm placing emphasis on multiply injured patients. You must know the proper definition of multiply injured patient and how to manage a multiple injured patient, because most of the trauma that presents to the emergency department are multiply injured or polytraumatized patients. Okay, please, you should know about this and how they are resuscitated and managed. Okay, this is a common question, and a lot of things you will learn from this topic. The ATLS protocol, primary survey and resuscitation, secondary survey and definitive treatment. You will learn about the Glasgow coma scoring, of a patient, okay, with head injury. You learn management of chest injury, blunt abdominal injury, penetrating abdominal injury, chest, thoracoabdominal injury, long bone fractures, several. This topic, if you read multiply injured patients thoroughly, you know everything about trauma. And trauma currently is at epidemic proportion in our environment because of a lot of violence, a lot of so many causes of trauma. So you should know about this, okay? Now, pediatric surgery, neonatal intestinal obstruction is common, anterior abdominal wall defect, anorectal malformation, Hirschsprung's disease, neuroblastoma, nephroblastoma, cystic hygroma. Now, a lot of pediatric surgery questions feature in your picture test. So, but these are high yield topics you must know when studying pediatric surgery, okay? Especially you see a lot of anterior abdominal wall defect presenting with either omphalocele or gastroschisis, anorectal malformation, Hirschsprung's disease. These also feature in your exams. Okay. Now, plastic surgery, the one of interest here is burns. Burns. There is a lot to know about burns. So all these others are usually you see them, not very common in your picture test. They ask some specific question, but regarding burns is very important. Now for cardiothoracic surgery, okay, chest tube insertion, okay, is very important. Especially picture test, you see instrument about chest tube, they ask you about triangle of safety. They ask you about the deadly dozens. The deadly dozens. The lethal 6 and the hidden 6. And several other things about chest tube. Now, you should know about this, please. The deadly dozen. Okay, there is no way you study trauma and you are not taught about the lethal 6 and the hidden 6. Neurosurgery, this is very important. Then this almost always you see them in your exam. Hydrocephalus and spinal bifida, almost always. Of course, basic instruments, radiographs, and procedure. Now, we've talked about this extensively. You can, in fact, you can watch the videos multiple times and you get, I don't think they will ask you any instrument that go beyond most of those basic ones we discussed in detail. So you can just get familiar with those and watch them more frequently. Now, if you are wise, you may not have time to read everything. Don't wait for us to cover all these lectures before you start reading them. You can watch some of the previous lectures. We already gave these lectures to previous students. You can just watch them at your leisure time and they become part of you. At your leisure time, passively you absorb knowledge. Okay, you don't have to wait. Maybe this will take 3 to 4 weeks before we discuss them. When we now start discussing them, you are just only revising them. Okay. Now, obs and gynae. Now, let me tell you something. Sometimes after the exams, when candidates are coming out of the hall, I often ask them, what part is what part came out most? Some will tell you, it's gynae. Some will tell you it's medicine. Some will be confused, they don't know. Most of the time I hear candidates will tell you it's more of gynecological. But the truth of the matter is you can see these questions are spread evenly amongst all these topics. Maybe some that will say gynae, they found that more challenging, okay, than other topics. So they tend to waste more time in that area. Then they will now feel as if it is only gynae questions that were asked. But all the same, you should know these common high yield topics: amenorrhea, uterine bleeding, infertility. Like cervical cancer came out in the last exam. Okay. Now, with my interaction with gynecologists, especially in our center, they are telling us that, because I usually join them most of the time in some surgeries that may require a general surgeon being around, I found out they are telling me that this uterine cancer is on the rise and it has gone even beyond cervical cancer. So you should take note. This is becoming something of concern. And it's not surprising because the awareness for screening against cervical cancer is on the rise. A lot of patients go for screening and they take appropriate measure against cervical cancer. But uterine cancer is on the rise. Abortion, okay, ectopic pregnancy, trophoblastic diseases are common conditions. This doesn't mean there are no other topics in gynae, but these are common ones you should have on your fingertips. Then for obstetrics, antenatal care, almost always, physiology of pregnancy and lactation, normal labor and abnormal labor. You should know about that. Both the complications of all the complications that may follow labor. Now, puerperal morbidity, puerperal sepsis, antepartum hemorrhage and postpartum hemorrhage. Let me underline these two. Okay, they are high yield topic. Multiple gestation, you see this in your picture test, and a lot of questions follow that. Malaria again in pregnancy, sickle cell disease in pregnancy, preeclampsia and eclampsia. This is so important that when it comes during your call hours, it keeps everybody awake, from the patients, from the doctors at the emergency, from the doctors in the blood bank, from the doctors at the chemical pathology lab. Everybody is awake, okay? So this is a very serious obstetric condition that you must know inside. Hypertensive diseases in pregnancy, diabetic mellitus in pregnancy, cesarean section. Now you must know about partograph, okay? Dr. Mariam will deal thoroughly with that for you. She has already done that, and I think the lecture is available. You can review that before she does another one for your own group. Then instruments for common gynecological instruments. You see them in your picture test. Now, from all what we even discussed, those are just 3 subjects. We've not talked about pediatrics. We've not talked about public health. I believe now you are really sensing the kind of task that is ahead of you. And you can see the reason why people fail MCQs a lot, fail the Mdcn exams, and a lot of talks are flying around about the exams. But let me assure you, do your best, okay? Cover these topics. You won't be among people that are complaining. I assure you of that. cover these topics with the outline I gave you at the beginning of this presentation. Ask yourself, do a personal assessment. You see, sometimes when you are ready for an exam, you yourself, you know you are ready for that exams, okay, based on what you have covered. I'm not excluding anxiety. Of course, you have some anxiety, jitteriness, which all those are even a kind of lessons by the extent of your preparedness and the extent of stuffs you have. If you are just dull to percussion, you don't have any stuffs, of course, you will be afraid and you'll be looking for shortcuts. Now, obviously, there are no shortcuts if you want to read all these topics thoroughly. Okay? Pediatrics, child health, and primary care. Immunization, especially our NPI, National Immunization Program of immunization. You should know how our chart flows. In fact, you should have the charts at the back of your door, in your door, so that anytime you are going out, you just glance at that chart. After today, go and print it and study how immunization schedule is given, all the components there. Nutritional status, how to assess nutritional status of a child, anthropometric measurements of a child, developmental milestone. Of course, you can be given a child or you can be told some certain features of that child and you are asked what is the age of that child. So if you are not conversant with developmental milestone, you cannot, okay, know the age of the child. Poisoning, there are various forms of poisoning, but kerosene poisoning, drugs, and of course, there are some poisoning from cosmetics. You know, in our own time, they ask us a lot of kerosene poison because I know most of you now are not victims. I know some of you don't have never even seen kerosene before. So, but before they ask it several, it's a very common question because most of us in the past, we've drank kerosene accidentally. Maybe we see it in a container that looks like the one they put water in the fridge for us. You have similar container, one black jerry can, one is in the fridge, and one is outside. As a child, you will not differentiate it. It's after you have drunk like 50 mils of kerosene, you now realize you did not actually got it from the fridge. But all of you now, you will not know that experience because it's dispenser you use now. Nobody will even fetch water from the tap and say he wants to go and put it in the fridge. So in the past, kerosene poisoning is very common, but nowadays is cosmetics. Most of the cosmetics, shampoos at home. And what you should know about this poisoning from shampoos and most of the cosmetics at home, they are alkali. So they are alkali poisoning, and alkali poisoning tends to cause liquefactive necrosis. So they cause esophageal stricture, which is also a common pediatric problem. Okay. Acid cause coagulative necrosis. So most of the time they don't affect the esophagus. It is alkali poisoning that affects the esophagus. So drug overdose, okay? Any drug you see, it's written to keep out the reach of children. So it's something that is common. Of course, now kerosene poisoning is not common, but you should know about poisoning generally. And then child abuse. Yes, in this last exam, you should know it came out. Yes, these last exams that held, it came out. I think it's a picture test of somebody trying to strain a child down. something like that. But if you don't know about this, you might not understand what the question is talking about. So it's all about what child abuse. Now, infection in our environment. All these specialties deal thoroughly with infection. Now, in our environment, measles for pediatric age group, malaria, tuberculosis, salmonellosis, giardiasis, schistosomiasis, HIV in children, they are all common conditions. Now, aside these miscellaneous topics and topics about child development, there are disease of specific organ systems that are common and present as high yield, like congenital heart diseases, rheumatic heart diseases in children. If you go to pediatric ward, almost 90% of those patients with heart failure are as a result of congenital heart diseases. So it's very common. Then bronchopneumonia, bronchial asthma, tracheoesophageal fistula. Okay, then GIT, diarrheal disease, please, and the management. If you will not know anything in pediatrics, please know how to identify and manage diarrheal disease in children. Please, the use of ORT, management of dehydration in children. This is an unpardonable offense if you don't know how to manage dehydration in children. Mild dehydration, moderate and severe dehydration. How you give of course, for mild dehydration, you give orally. If the patient cannot take orally, in fact, a child cannot take orally the amount you want using ORS, you have to pass NG tube. In fact, sometimes moderate dehydration in pediatrics can also be corrected with NG tube. Don't think it's only mild dehydration, but the bottom line here, you must know how to correct dehydration in pediatrics. See, you have no business going through that exams. If you don't know how to correct dehydration in children, it means you are not safe to be a doctor. Please, I'm emphasizing this. You must see hypoglycemia, diarrheal disease, dehydration, convulsion in children. Okay, you don't know how to identify and manage this, it's not safe. Okay, because these are things that can quickly kill a child and they take effect in minutes. Okay, there are some conditions that will cause irreversible brain injury, damage, like hypoglycemia. Identifying this in a child. So, management of dehydration, you must identify what is mild dehydration, what is moderate dehydration, what is severe dehydration. In moderate or severe dehydration, how do you give the initial bolus for resuscitation? How do you give the maintenance solution? How do you get the maintenance fluid? Okay, how do you monitor a child receiving IV fluid? When is it enough? When do you know that you are overloading the child? Okay, protein energy malnutrition. Okay, marasmus, kwashiorkor, that one is almost always constant. Then these are other topics that based on systems, acute glomerulonephritis, okay, nephrotic syndrome, renal failure, endocrinology, hypoglycemia. You see this? You must know how to correct hypoglycemia. See, let me tell you something. If you don't know anything in pediatrics, okay, you must know how to correct hypoglycemia. Not because of only your exams. Malaria in children, especially severe malaria, convulsions, how to abort convulsions, okay? You see, these are very, very important diarrheal diseases. Okay? Dehydration. Please and please, don't joke with all this, not only because of exams. These are things that are a matter of life and death of a child. No examiner will ever forgive you if you don't know anything about these exams. Sincerely, no doctor can be safe if he cannot recognize and manage hypoglycemia in a child. Okay, he cannot abort convulsion in a child. He cannot manage diarrheal disease. He cannot manage dehydration. Okay, rickets. You see them in your picture test. Yes, diabetic mellitus in children is there. Okay, you might see, not very common, but these first two are common. Cerebral palsy, meningitis, encephalitis, convulsions. Musculoskeletal diseases, bleeding disorders in children are of concern. Child with hemophilia presenting with recurrent joint swelling, okay, bleeding. They will have history of bleeding, excessive bleeding after maybe circumcision, after tonsillectomy, after something they kept on. So that history is there. Then subsequently, they started bleeding into their joints. Genetics, chromosomal abnormalities, oncology, Burkitt's lymphoma, Burkitt's is common and it's almost always feature in all exams. Retinoblastoma, neonatology, you talk about neonatal jaundice, neonatal sepsis. Now, the last aspect we'll talk about today before we entertain a question and answer session is the community medicine. History of medicine, yes, you should have some idea about who is the father of that, who is the father of this, who invented this, who invented that. I think I'll give you a PowerPoint on that so that that will be enough. You don't need to go too far in looking for several pages on history of medicine. Then environmental health, environmental sanitation, waste disposal. In your last exam, you saw something in the picture test about dustbin, about disposal, yes. Vector control, they asked what are the hazards? They are asking about environmental hazards that could result from that inappropriate waste management. That was an open dumping. And what are the hazards that were associated with open dumping? So this is a topic on environmental health, okay? Vector control, air pollution, food hygiene. So this is a very, very important topic in your exams, environmental health, primary health care, all the components, organization, and all those definitions. Then demography, study of population, there are some specific definitions you need to know. Then biostatistics, you understand variables, their definition, types of variables, qualitative, quantitative, and so on. Then measure of central tendencies, okay, mean, median, and mode, measure of dispersion, standard deviation, variance, disease outbreak, principle of epidemiology, okay? This you should know because of transmission and the various ways of disease transmission, okay? All those. Occupational health, occupational hazard. I think there's something of this nature on occupational health in the last exam. You see, one thing about these exams, some questions will be asked, but if you don't know the topic it was asked from you, you will be confused. Somebody was telling me in the last exam that there was pure water, sachet water. He was asking, how will they be asking pure water? That is to tell you he doesn't even know what he's supposed to cover. He was complaining, why will they be projecting pure water on picture test? You can imagine. So he doesn't even know the areas he's supposed to read. And he was complaining bitterly that there was sachet water on the exams. So please and please, you need to take all these topics seriously, okay, and know what you are expected of. For this, you will be provided with PowerPoints that will ease your work for the revision, okay? In that, our lecture notes, community medicine was not added, is in the volume 2, which has not been published yet, but all the community medicine you are supposed to know for the exams, you will be given as PowerPoint. Yes. Then infectious disease epidemiology, disease control and eradication. There are several definitions here and some terms you need to know. Then research methodology, especially when you are talking about hypothesis testing. I think this is the important one you need to know about hypothesis testing here in research methodology. Then non-communicable disease, all these chronic diseases, hypertension, diabetes, and so on. Then zoonotic disease. Yes, this is a common question, zoonotic diseases. International health, almost always they ask about some of these international organizations, WHO, UNICEF, and so on, reproductive health. So we've come to the end of this presentation. As I told you, the essence of this is for you to know what is ahead of you and know how to prepare. Of course, we took a lecture on orientation for this, your preparation, which you can still go and review so that you always be on your toes. Now is a session for question and answer. So I'm going to allow a session for question and answer. If you have any question, please, you can unmute yourself and ask. If you don't have any question, you can remain unmuted. So, but if you have a question, please unmute yourself, ask your question, then I'll go ahead to answer your question. Thank you very much for your attention. Any questions?
Good evening, sir.
Yes, good evening. How are you?
My question, I'm good. Thank you so much, Doc. We appreciate what you're doing. And my questions are on the MCQs, like the computer questions. What would be your recommendation on the timing for students to practice to be able to finish your MCQs on time and effectively faster? And maybe if there's any pointers that we should take.
Okay, that is a very good question regarding MCQ because it's one of the rate determining steps of passing your exams. This question, I think we dealt with this thoroughly in the last presentation we did on the orientation on Mdcn licensing exam. We talked about MCQ, how to prepare and how to pass it. So if you've not reviewed that, you can still go back and review the orientation. But notwithstanding, I'll still answer that. Now, one thing about MCQ, you need to know the most important thing you need to know about MCQ is frequent practice. Once you frequently practice MCQ and time yourself during practice, I gave 3 ways of studying MCQs. You have your study time, you have your practice time, okay? Because that your study time, you use it to get, because MCQ assess the depth and width of your knowledge, okay? During your study time, you can answer 100 questions for the whole day. Okay? While during your practice time, you have to time yourself. You time yourself 60 minutes. That is 1 hour. You want to answer 100 questions. You set your time, your stopwatch. Immediately it's 1 hour. You stop and mark yourself. Assess. How many questions did you answer? Okay. What were your challenges? The ones you answer, how many did you pass? So with repetition, as I told you, repetition is the secret of learning. When you keep on doing this frequently, you are going to master MCQ. And when you go for the exams, it's just going to be a walkover. So I'll recommend you go back and review that orientation lecture we did. A lot was said about MCQ, but I hope this short answer I gave is helpful.
Yes, thank you so much.
You're welcome. Any other question? Okay, we still have like 10 minutes for questions. Okay. In the absence of any question, I think, okay, somebody sent a question. I'll prefer you to ask questions rather than sending messages. So you mentioned about textbooks. Yes, we talked about textbooks. I think the next lecture that I will do is review of textbooks. Yes, we are going to review all the textbooks you need to know. Maybe in the next 2 weeks, we are going to do a review of textbooks. We've done a general orientation. We've done on high-yield topics. And the next one will be on review of textbooks. Okay. Yes, you can. Where I'll bring up all the textbooks you need to use to prepare for all these topics we highlighted. Okay, in the absence of any question, I think we are going to stop here. You can still have access to this lecture we just did on this site. Okay, it is there. You can have access to it to maybe refreshing your memory. So thank you everyone for joining. We are going to end the meeting here.